Hey, how are you guys? This is Shay coming back with you for another video. We are going to go over homeostatic imbalances, kind of talk about anatomical positions, and yeah, that's primarily the biggest things that I want you to take from the lecture is knowing anatomical position. So we're first going to talk about what is an imbalance, right? What is an imbalance? Previously, we talked about homeostasis and how things were in perfect balance, right? You had the sameness across the board. We describe this in terms of temperature. The body likes to have the temperature at around 98.6 degrees Fahrenheit. If it gets shifted in either direction, either too hot or too cold, we start to have an imbalance. That's never good. We like the body to stay in perfect equilibrium. So, whenever you have an abnormality in a structure or a uh, function, we call that a disorder, right? It can be a pituitary disorder. There's an abnormality either in the structure or the function of it. Maybe we're secreting too much hormone. Um, Maybe we're secreting too much thyroid hormone and we have hyperthyroidism. Patients get very skinny. They have protruding eyes oftentimes if it's due to Graves' disease. Sometimes they'll lose hair, their skin may have abnormalities, different things of that sort. Um, Whenever we are able to discern the signs and symptoms um, of the illness, we call that a disease. So these two are related. You can have a disorder, having an abnormality in a structure or a function, right? Whenever we can discern the signs and symptoms of the illness, we call that a disease. Now, the study of disease is called epidemiology. So I want you to think of it as we have a disorder, that's an abnormality in a structure or a function. Because we have a disorder, we can now see signs and symptoms. We call that a disease process. And from there, we have epidemiology, which is the study of the disease. So, again, this point at the very bottom, this goes without being said, but if the homeostatic imbalance is moderate, a disorder or disease may occur, right? If severe, then we have death. So let's use the example of thyroid hormone. So the hypothalamus is secreting TRH, right? This is thyrotropin releasing hormone. You guys don't need to know this yet. Just want you to see it as um, a reactant, right? We're secreting something right here to make TSH. This is thyroid stimulating hormone. And TSH is going to make the thyroid grow, or it's going to produce T3 and T4. So T3 and T4 are able to be produced. This is what normally happens. So what is abnormal? Well, let's say we don't have any iodine. Iodine is needed in order to make T3 and T4. If we don't have enough T3 and T4, then guess what's going to back up? TRH and TSH. TSH will be high, but we have no T3 and no T4. Well, what does T3 and T4 do? They're responsible for metabolism. So patients with severe hypothyroidism can go into something called myxedema coma, and if um, it goes untreated, they can die. So just want you to see that this is all about balances, right? So what do we do for these patients? We give them T3 and T4. Which is essentially just a hormone in order to make their metabolism work. So I want you to see this as a balance. The hypothalamus, again, is going to produce TRH. TRH is going to go to the pituitary to produce TSH. From there, we're going to produce the mediators, T3 and T4. They're going to produce an effect and raise the metabolism and allow the body temperature to raise, allow mental processes to occur, to allow us to think, allow us to function. From there, we function normally. But if something happens and we have a disorder, in which a structure or a function is broken, then we'll have a disease. We'll start to display signs and symptoms. Um, so uh, this is just kind of like an illustration to go along and show you. These are our different control mechanisms. I'm not going to go over them all. I just want you to see that there are a numerous amount of um, control mechanisms built within the body to allow for normal function to occur. So we have electrolyte balances. You guys have potassium. The potassium gets too low, we can have signs and symptoms, and a disease process can ensue. Your body has a built-in mechanism to raise and lower the pH of the blood. If your body gets too acidic of the blood, we call that acidosis. If the pH goes too high, we call that alkalosis. There's a bicarbonate buffer system that is built in order to maintain an appropriate pH. You also have different oxidative systems. We have a way to rid our body of oxidative stress, right? We have natural antioxidants built in. Again, we just discussed some of um, the endocrine homeostatic mechanisms dealing with thyrotropin releasing hormone. Prostaglandins, these are going to be things that mediate vasodilation and pain within the body and the inflammatory process that occurs. Whenever you take aspirin or ibuprofen, this helps inhibit this process. We'll discuss that later on. And there's different catabolic and anabolic effects. If you guys remember, catabolism is the breakdown of products, and anabolism is the building up of processes. So this is all of our intracellular oxidative mechanisms dealing with metabolism. This is cellular respiration, glycolysis. This is peptide formation, polypeptide formation. This is lipolysis, the breakdown of fat. Um, this is proteolysis, the breakdown of proteins that occurs. So this is kind of deals with going back to the previous lecture when we discussed insulin and glucagon, how it can either raise the blood pH, raise the blood glucose or lower the blood glucose. There's different mechanisms. For example, whenever you lose weight, your body likes to break down fat through a process called lipolysis. That's why if you take down your calories that you're consuming, the amount of food that you're consuming, your body starts to break down fat in order to maintain the normal blood glucose level. So that's a homeostatic mechanism. And it just so happens that it benefits you by losing weight. So again, not going to go over these too in depth, just kind of giving you all an understanding that your body has a numerous amount of mechanisms built in. What I do want to kind of focus on for the majority of this lecture is the basis of anatomical position. And I think it's best to probably look at a picture and see that the normal anatomical position, the person is going to be standing upright with the palms facing forward. Okay, this is called the upright position, and the palms are facing forward. I'll demonstrate this in lecture to you, but we'll read the text here. The subject stands erect, facing the observer, with the head level and eyes directly facing forward, and we can see that here. The feet are flat and directed forward, and upper limbs are at the side with the palms turned forward. So you can see the feet are upright and facing forward, and the palms are facing forward as well. So there's two different terms that we describe someone. So I want you to imagine that this guy is laying on a table or a blanket right here. This is a blanket covering a table. This could be an operating table or anything that he's laying on. So whenever he is laying on his back, right, I want you to imagine him laying directly on his back. We would call this the supine position. Now, if he were to roll over and his face be on the mat itself and he would be face down, we would call that the prone position. So again, the prone is when the body is laying face down. Supine is when the body is laying face up. So this is called anatomical position. And the reason this is important is because you could be in surgery as a nurse, and usually the surgeons, if you're, they always like the patient to start out in the anatomical position before you begin to place them to the area that you're beginning to operate on. Or if you're in gross anatomy, we always have the patient in an anatomical position. This just kind of lets us know what we're referring to when we talk about structures as well. So it's kind of just like a basis for understanding different terms like proximal or distal, just the basic foundation of anatomy is understanding this position. So now we're going to find out some newer words. Some of them you've probably heard, some of them you may not have. But either way, this is a good place to start for understanding regional names. So when we talk about the head, sometimes you'll hear it referred to as the word cephalic, and you need to just be uh, comfortable with that term. Uh, so the cephalic region or the head region. The neck is often called the cervical spine, or the neck. The trunk is just the trunk, and this consists of the chest right here, the abdomen right here, and then the pelvis right through here. So this is the trunk. So you could say that the man had numerous bruises or lacerations present on his trunk. If you read that in an ER note, you would know that they're talking about the chest, abdomen, and maybe even the pelvis. When we talk about the upper limb, this is kind of self explanatory. We're talking about the shoulder area, the armpit, the arm, the forearm, and the wrist and the hand. So, this whole area here is talked to or is described as the upper limb. And then the lower limbs, of course, this is everything consisting of the buttocks, the thigh, the leg, the knee, ankle, and foot on down here. So, again, just to kind of reiterate these points, the cephalic region, this is the head. Cephalo actually means head. Uh, so the neck or the cervical region. Then we have the trunk. Then we have the upper limbs right here. Then we have the lower limbs, which is going to consist of the leg, ankle, and foot area, and the buttocks region. So just words to be familiar with. And again, these are just kind of showing you pictures of the supine and prone position. The supine position is going to be facing upward, faces facing upward, and prone, they're laying on their back. And during COVID, you would often hear about, yeah, I remember when I was in the hospital, sometimes we would have to prone patients. So you would walk around and I would ask, is he prone? Is he in the prone position? And that would mean, is he face down? And the reason that was important is because patients with COVID were having difficulty with oxygen exchange. When you're in the prone position, we'll learn later on in the respiratory section that oxygen exchange is able to occur more efficiently. Um, so, just something to be a note or to be aware of. So these are important these are important directional terms. So we have the body regions, we know there. So these are going to be directional. These are going to describe where things are at relative to another. And we'll go over here to the picture to kind of illustrate this. So superior is going to mean toward the head or upper part of the structure. So I would say the head is superior to the foot, right? Um, Vice versa, the foot is inferior to the head, right? It's away from the head or the lower part of the structure. Anterior is going to mean front. Posterior is going to mean back. Another word for anterior is ventral. You'll often hear that, the ventral. Uh, so they could say uh, the ventral portion of the lower limb. Where would that be? The ventral portion of the lower limb. So the ventral portion or the anterior portion of the lower leg. Now, if I said the dorsal or posterior aspect of the upper limb, well, that could just be the back of his arm, right? So this is just two words to directional terms, anterior, posterior, meaning front or back, and then you know the regions, upper limb and lower limb. You know superior is up towards the head, you know inferior is um, below the head. Medial is going to mean closer to midline, right? So, and then lateral is away from midline. So when you think about medial and lateral, I just want you to think about midline. Medial means medium or in close in between the middle. Lateral means away. So that's pretty easy one, I feel like. Intermediate, this is a tough one. This is hardly ever used. but it's between two structures, right? You won't hear that one much, at least in my practice. Ipsilateral means on the same side, so the ipsilateral arm and leg. So the right ipsilateral arm and leg, right? So the right-sided arm and the leg. So ipsilateral is on the same side of the body. Contralateral. He had a right-sided uh, lesion, and on the contralateral portion of the body, he had another lesion. So on the right side of the body, contralateral means opposite. So on the opposite side of the body as another structure. Contra means away. Proximal means near the attachment of the limb to the trunk. So on the proximal aspect of the forearm. So we've got the forearm here. Proximal means up here. Distal means away. Um, so we're talking about, let's say we're talking about the leg. So on the proximal portion of the leg versus the distal aspect of the leg. Proximal means up here near the attachment of the limb. Distal means away from the attachment of the limb. Superficial means near the surface. So if the surgeon told you to make a superficial incision, that would mean near the surface. If he asked you to make a deep incision, this would be deep to the surface of the area or away from the surface of the body. Planes and sections, these are a little bit more difficult. Once you see the picture, I think it'll make a little bit more sense. It's just the way the body is divided up. It's just an imaginary surface that passes through the body, and you can see that here. So a sagittal is just a vertical line that kind of goes through and divides the body into half. Excuse me. Divides it into right and left sides. And for now, I won't go into mid-sagittal and parasagittal. I just want you to be familiar with what the sagittal plane is. It's a vertical line that cuts the portion in half, dividing it into right and left sides. Coronal is going to be a cut that divides the body into anterior and posterior portions. So you can see sagittal comes through here, divides it into right and left. Coronal is like it's going to go across the head, almost like a horizontal cut right here. And this is going to divide the body into an anterior portion and to a posterior portion. Okay. And these different planes, sometimes you'll hear something called a sagittal CT scan. And this is going to be a scan that divides the scan into a right and left side. So you kind of need to be aware of what plane you're looking at whenever you're looking at structures. The transverse plane is going to be a cross section that's going to show horizontal plane. It's going to divide it into upper and lower. So this is literally going to be a section that cuts it in two right here. So you can see this structure in half, right? It's going to show a superior and an inferior portion. An oblique plane, this one, you'll see it sometimes, very rare, but it's going to pass through a body or an organ at an angle between a transverse plane, either sagittal or coronal. The ones I would like for you to be more familiar with is going to be the sagittal, coronal, and transverse. Knowing the sagittal is going to divide it into right and left, coronal is going to be anterior and posterior, and the transverse plane is going to be a superior and inferior cut. So again, here you can see the coronal dividing it into a anterior posterior portion. The transverse is going to be a superior inferior portion, and then the mid-sagittal is going to be a right and a left. So now we'll go into what's most likely just review for you guys. Whenever we are dealing with once we start getting into organizational topics. Once we start getting to life in general, it has different levels of organization, right? And we know that matter is anything that occupies space. So it's going to consist of 4 different phases. This is going to be solid, liquid, and gas, and then something called plasma as well. Chemical elements, what all forms of matter, living and non-living, are composed of, right? And each is denoted by a chemical symbol. You guys are familiar with the periodic table of elements. I'm not going to beat a dead horse on this one. And again, you know the major elements. I guess this would be more important for our purposes. The major elements of the body are going to be organic and inorganic in nature. They're organic, they're going to have carbon, consist of carbon and hydrogen. They're inorganic, anything that is inorganic consists of anything other besides anything other than carbon and hydrogen. So the body's primarily composed of organic components as well as some inorganic. So we know we are made up of primarily oxygen, carbon, hydrogen, and nitrogen. That's important. You guys should know this. These are going to be the four elements the body is primarily made of, right? These are going to consist of all the metabolic processes within the body. It's either going to be carbon, oxygen, hydrogen, or nitrogen. Some of the lesser elements, these are going to be more along the lines of electrolytes and trace elements. So calcium, phosphorus, potassium, sulfur, sodium, chlorine, magnesium, and iron. So iron is going to be responsible for the makeup of hemoglobin. You have an iron bound to a heme molecule, right? Potassium is going to be responsible for electrolyte balance within the body. Maintaining a proper potassium or an adequate potassium level is extremely important. If you have too little, you can have something called hypokalemia, and you'll start beginning to experience symptoms such as muscle cramps, bradycardia, which means slow heart rate, and things like that. Sodium is going to be important for maintaining an electrochemical gradient, which is going to be important when we discuss the sodium potassium pump, which is going to be should already be familiar with from Bio 112, maintaining intracellular and extracellular gradients through simple and facilitated diffusion. So calcium, phosphorus, all these things are going to be important. Just want you to be familiar with these. Knowing that phosphorus is a trace element is an important thing to know. And here we just know that ATP is going to be made up of adenine, a thymine, and a phosphate residue, right? Adenine triphosphate. An adenine and 3 phosphate residues. So phosphorus is going to be important for making up phosphate. As you can see here, dealing with the Earth's crust in relationship to the human body, you'll see that the oxygen is primarily made up of around 65%, carbon being 18%, and then hydrogen being 10. Nitrogen will be somewhere within this other, but again, this is primarily the main compositions of the human body. You can see over here that oxygen primarily makes up most of the Earth's crust, as well as these other different trace elements that are present as well. So knowing these key terms, this should be primarily review for most of you guys, knowing the atom is the smallest unit of matter that retains the properties and characteristics of the element. We know that atoms are made up of three subatomic particles. The electron, which is negatively charged, which is present in those outer shell and those orbitals, going to be responsible for bonding through the octet rule. Remember that you may lose or gain an electron depending on how many electrons you have in your outer shell, depending on what's favorable. Neutrons are going to be neutrally charged. Does anybody remember where neutrons are located? Within the nucleus, absolutely. And does anybody remember what else is present within the nucleus? Protons, exactly. Protons are positively charged. So protons and neutrons are going to be responsible for making up the atomic mass. The AMU, whenever you have different numbers of protons and neutrons, does anybody remember what that's called? Sorry, not protons. Protons should always stay the same within an element, right? It's the neutrons that differ. That is what makes up isotopes, right? So the atomic number is the number of protons in the nucleus of an atom, whereas the atomic mass is going to be the average of the mass of all the naturally occurring isotopes. The another term for the atomic mass is the number of protons plus the number of neutrons. That also makes up the atomic mass. And the half-life is just the time it takes for half of the atoms of the radioactive isotope to decay in order to form a more stable form. So here is a picture depicting where the location of the protons and the neutrons are. They're present within the nucleus, and these orbitals that you can see here are present within the outer shell. You guys remember you have S, P, and D, which are going to be responsible for your orbitals. I won't beat that to death, knowing that S can hold 2 electrons, P can hold 8 electrons, and then D, which is in the third shell, can hold 18. So, going over the different types of bonds, you have ionic, which is going to be a charge between a cation, which is a positively charged ion, and an anion, which is a negatively charged ion. So, these are going to, whenever a positively charged ion comes together with a negative charge, you're going to have a bond occur. This could be an example, such as sodium chloride, sodium being positively charged, that's your cation, and chloride being negatively charged, and that's your anion. So these will form. And does anybody know what sodium chloride is? It's just salt, right? So covalent is going to be equal sharing of electrons. This is when electrons are shared equally. There's two different types, nonpolar and polar. We won't necessarily go over those. Knowing that polar covalent bonding is due to an electronegativity. Um, so when the sharing of electrons between two atoms is unequal, thus generating greater electronegativity for that atom. And water is an example of a polar covalent bond, right? And it's that oxygen present within those two hydrogen molecules that creates that electronegative charge. So that is why water is termed polar covalent. And then hydrogen. This is actually incorrect. So hydrogen bonding is actually the strongest of the types of bonds. So whenever we see the three different types of bond, if I gave you a question that said ionic, covalent, and hydrogen, which of the following is the strongest type of bond, it would be hydrogen, right? Then uh, we know that ionic is between a cation and an anion. This creates a strong electronegativity attraction. And then we know that covalent bonding is just an equal sharing of electrons. So technically, water has two different types of bonding. So you have a hydrogen bond between the oxygen and the hydrogen, and then you have a polar covalent bond between the oxygen molecules due to the difference in electronegativity. So here's just an example that I've shared. Sodium and chloride coming together. This is a form of an ionic bond. You have the cation right here of the positive charge sodium, and you have the negatively charged chlorine molecule. This is an example of a covalent bond. You have equal sharing of electrons here. This is an example of hydrogen bonding to an oxygen. So which atom is electronegative? Does anybody know? It's the oxygen. The oxygen is the electronegative atom, right? Because it's that oxygen molecule which is creating that electronegativity. So this polar covalent molecule is responsible for DNA base pairs, interactions, water surface, tension. This picture here is simply just showing you that water is responsible for a lot of the different biochemical processes that are present within our body, whether that be DNA based pairing, whether that be water surface tension, whatever it may be, water is going to be present within the majority of the biochemical processes throughout life. So, again, the major take home points are going to be the anatomical position, knowing what is anatomical position, knowing the different terms superior, inferior, medial, lateral, proximal, distal, knowing those things. And then I would also be very familiar with the different planes that we discussed earlier. So if you have any questions, please feel free to reach out to me. Just wanted to provide a brief overview before class. Again, these are very important um, to watch prior to class, as whenever you come to class, I'm going to ask questions, and then I want you guys to be able to answer these questions. So if you watch these videos and you listen to the lecture, I can guarantee that you'll probably at least receive a B at the most, or at the least, and then most likely an A. So I appreciate your time and attention. If you have any questions, reach out to me in the meantime.